COE has made me a better resident and a clinical pharmacy specialist. It's been an amazing experience, but not only that, it's been a family to me. Because of COE, I've been able to interact with so many different healthcare professionals that have not only bettered me in terms of medicine and practice, but also as a better human being, caring and optimizing care for our patients. The experiences I had have been paramount, and they have been memorable to say the least. Because of COE, I am more of a versatile, confident, open-minded pharmacist, and it's going to help me greatly in the next few years.
So I would say something that I will take away from this is looking at the patients from a more holistic manner and looking at how I can work on in a professional team and use the resources of my colleagues that I work with in order to better improve the care that I provide.
Working at the Center of Excellence for 1 year was absolutely beneficial to my career. Having a 1 year training in primary care and then having some specialty rotations as well has just made me more comfortable with interacting with patients, with managing health one-on-one basis, and also in the team-based interdisciplinary aspect of it, understanding what other healthcare professionals can provide in the management of veterans care. So it's been absolutely invaluable and has made me feel so comfortable with my practice and every day.
For me, it was really rewarding to be a part of. A lot of trainees are coming together and you're able to really talk about a lot of experiences on patient care, as well as just what it's like to be trainees and what it's like to be in the different settings. And so I really benefited from kind of recognizing what my role was as a mental health provider on the team, and it was really nice being able to educate others on my experiences and kind of what I bring to the table, and get feedback from other people on what they wanted to see from the mental health provider on the team, and to just learn what it's like to be a part of a setting where everyone is working together to better patient care as a whole.
It really just showed the diversity of each clinical lens and the ways that they overlap, but also the ways that they're different and how those differences are strengths. So it just shows how all that coordination really helps with getting the patients what they need in a timely manner, but also motivating the patients to feel like they have a whole team around them to get what they need done and take care of their health.
For me, I really enjoy having the experiences with my colleagues as far as working on the QI project. We really bonded with all of the different projects that we worked on. And even outside of the COE, going and the homeless stand down, we really enjoyed interacting with veterans outside of the hospital.
Yeah, so what was rewarding for me also is just seeing everyone's dedication to patient care, and that we were all working on the same goal, which was to the whole health of the veteran. So working side by side, and especially as psychologists, being able to have an equal voice at the table, and also being on the same team with medicine, I think was a really rewarding experience. So it's something that's not offered even places or settings, clinical settings, in the VA, where it's supposed to be more integrated. There's a level of integration I hadn't been exposed to, and it's definitely something that I think should be a model for PCMHI in the future.
I think as primary care providers, we can feel especially burdened and pressured to provide care that meets all of our patients' needs, which can feel very daunting to trainees that are still trying to just grapple with all of the clinical knowledge we're trying to learn about. And in addition, our patient population here at the Houston VA is particularly complex. They have a combination of acute on chronic medical concerns, psychiatric comorbidities, and often complex socioeconomic conditions that can make their care very difficult to meet in a single 20-minute visit. And I think that we've all had the experience of feeling like we have to be able to handle it all as the primary care provider. But working within the COE alongside these other trainees of other specialties who are literally right next to me, I think has really helped me overcome that sometimes burdensome feeling of knowing that by being able to manage my patient's diabetes, not just on my own, but with the help of my pharmacy resident, not feel like I have to spend just 2 minutes doing motivational interviewing. That's extremely important to overcoming their barriers to controlling their diabetes and hypertension, and knowing that I can do that alongside with my mental health colleagues, I think has really allowed me to provide more comprehensive care to my patients, and has also been very personally rewarding.
So COE, especially with home-based primary care being an interprofessional setting, has really been a staple in terms of why I decided to stay on at the VA. And I'm very glad to be here and take what I learned to COE with me for the rest of my career.